Welcome, everyone. My name is Ray Holloman. My pronouns are he, him, and his, and I'm a member of the Tennessee Transgender Task Force, sponsored by the Tennessee Department of Health. And as part of our Trans Healthcare 101 series, I'm going to break down what all those health insurance terms and concepts may mean for you as you start to navigate the healthcare system. And and we're going to start with really just an overview of kind of what we're going to go through today, which is an introduction, types of different types of insurance terms you should know, what trans exclusion policies mean, planning for costs, and do a wrap up at the end. And so, starting with an introduction of just what health insurance is. Health insurance is insurance that covers the whole or part of the risk of a person incurring medical expenses for spreading the risk over numerous people. Really, what that means is that when you buy health insurance, you're looking at in a population is being covered by a plan. And so everybody is pulling their resources into that plan to pay. And so then when you go see a provider, you only pay a partial share of that versus paying what the providers would actually charge for you. And so we're going to break this down a little bit more as we go through this, but we're going to start first with the different types of insurance. So in the United States, there's really two main different types of insurance. You have public insurance. Those are usually plans that are backed by either state or federal government, which includes your Medicare, Medicaid, CHIP, programs, and then you have private insurance plans, which are usually employer based or you get them out of the market or you're self insuring yourself. So, we're going to start with public insurance just as a way to really explain what that is. And so, public insurance, so Medicaid, or as is known in Tennessee, is TennCare. It's a program that provides free or low-cost health insurance for certain groups, including low-income income families, children, pregnant women, adults over 65, and people with disabilities. The federal government provides a portion of the funding and creates the guidelines, rules, and restrictions for how Medicaid can be applied. And they're named different things from state to state, but here in the state of Tennessee, it's TennCare. Medicare is a federal health insurance program available to adults usually over the age of 65, younger people with disabilities, and people with permanent kidney failure. A different type of public insurance that people can qualify for based upon your individual circumstances. And then there's the Children's Health Insurance Program, or CHIP. And in the state of Tennessee, it's called Cover Kids. It's an inexpensive health program for children whose families don't qualify for Medicaid because their incomes may be too high. And also, CHIP may also cover pregnant women in certain states. All states provide a version of CHIP, just like they provide a version of Medicaid, but the names may vary from state to state. And this being in Tennessee, it's TennCare and Cover Kids. And both of these programs can be applied for in the state of Tennessee by going to tencareconnect.tn.gov to see what the qualifications are to apply for one of these programs. And these are a really good way if you don't have insurance to go see if you're qualified, especially if you're low income, you're pregnant and you don't have insurance, or adults over the age of 65. So this is a really way to get some insurance to be able to provide for your medical costs in a public way. And then from there, we're going to move on to private insurance. And so, private insurance, there's different types of plans. So, we're going to kind of walk through each of the different type plans and just give a little bit of explanation. So, we're going to start with preferred provider organizations, a type of health insurance where if you use the providers in the plan's network, you'll pay less than what you use than using a net provider that's out of network. So you can usually use providers out of network, but there'll be an additional cost. So that type of plan gives you specific set of providers that you can go to get your health care from. And so you really have to be careful of making sure that you're going to those in-network people. Otherwise, you're going to be paying a higher price. A health management organization, or an HMO as it's called, is that it really limits who you can see except for doctors who work for that health organization. They generally will not cover any out of network care except for in emergencies, and it may require you to live or work in a certain area to receive coverage. Again, it limits you to who you can see basically if they work for there, because they want to manage your care in a more way to make sure that they're keeping costs down. And then there's an exclusive provider organization where it only covers if you use the providers inside of their network. So that is different than the preferred provider organization, because with the PPO, you can go to people out of network without a referral for an additional cost, but with an exclusive provider organization, you can only go to people inside of that network, except if it's in the case of an emergency. So those are three of the different types. And from there, we're going to talk about a few more different types of private insurance type plans. There's a point of service plan, and this is a type plan where you pay less if you use doctors that belong to that plan's network. So very similar to the preferred provider organization, except for with a point of service or a POS plan, it requires you to get a referral from your primary care doctor to see a specialist. So with a preferred provider organization, you may know who you want to go see for a specialist. With a point of service, you would have to go to a primary care doctor first and then go see the specialist after they refer you to that one, to someone that's probably inside of your network. So a lot of these plans are very similar, but there's little tiny differences that can make the difference of, are you able to choose your referral or are you not? From there, we're going to talk about a high deductible health plan. And this is usually a health insurance plan with a high deductible. The amount of money that you're responsible for paying for out of pocket is typically very higher with this type of plan than with the prior plans that we've talked about. But the monthly premiums are typically lower than the other plans that you may see. And so that's kind of the trade-off. Do you want to pay more money up front, per month for your premiums, or do you want to pay for a lower deductible overall, but you may have a higher premium? So again, these are all trade-offs of about the different type of plans that exist. And then there's the catastrophic health insurance plans. And they have a low monthly payment but a very high deductible. These are an affordable way to protect yourself if you're somebody who feels like they never get sick, or they don't want to pay, you know, to protect yourself, except for in the worst case scenarios like getting very sick or injured. You can use a catastrophic plan. But you'll pay for most routine medical expenses yourself. So if you're going to go get a physical, you're probably paying for that out of pocket versus your health insurance plan paying for some of that for you. So that's to know about what's going on with the catastrophic plan. And a lot of times you'll see these plans for people who are under the age of 30, or people that may have a hardship exemption or an affordability exemption. And a lot of that comes into the marketplace where you may qualify for a catastrophic plan, because you're taking you're lower risk than someone that is of an older age, or you have a hardship that makes it difficult for you to pay for your insurance. And so from there, we've kind of talked a little about, public insurance versus private insurance. And so those are really the main types of insurance that most people have. And so then we're going to talk about some of the terms that a lot of times come up when you start talking about health insurance and when you're going to see a provider for care. And so a premium. The premium is the amount of money you pay each year or each month to keep your plan active. If your health insurance is and provided by an employer, you may not pay your 100% of your premium each year. So they may pay a portion of it, and you may have to pay a portion of it as well. If you purchase an individual plan, though, you may have to pay the entire 100% yourself, and sometimes even with employer-based plans. But that's how much you pay each month to keep your plan active, so that you can go see the providers that you need to go to get the health care that you need. And so that's kind of how they get paid. And then the deductible is how much money you'll pay out of pocket for covered health insurance before your insurance plan starts to pay. So what you're looking at there is really, if you have a deductible of, let's say, $2,000, you'll pay $2,000 towards cover services before your insurance starts to pay. After that, you'll typically only pay a copay or co-insurance for covered care. So it's like the threshold that you have to meet each year before your health insurance starts really kicking in for you. So sometimes that can be as low as, maybe even $250, or it could be with those high deductible plans, it may be over $5,000 that you have to pay out of pocket before your health insurance plan kicks in. So those are the type things that you want to compare when you're looking at different type of health insurance plans. And then from there, we're going to talk about copay and co-insurance. So copay or copayment, that is a set amount you will pay for covered health services once you've met your deductible. And they can vary based upon whether it's for a medication, if it's for a lab, for doctor's visits. A lot of times it'll be, a flat fee of $20. That's how much you'll pay for your care. So whatever that flat fee is, that's your copayment. So once you've hit your deductible, then after you hit that point, any of the services, if they have a copayment with them, you're paying one flat fee for that service. So that's a really good way to manage your care once you hit that deductible. Coinsurance, though, is a percentage that is based upon that you'll pay for covered health insurance once you've met your deductible. A lot of plans are 80/20, meaning that your your coinsurance will cover 80% of the service, which means you'll pay 20%. So if a service is $100, your health insurance company is going to pay $80 of that, and you'll pay 20. And so copay and co-insurance a lot of times is the different ways when you go into the doctor and they run your insurance. They may tell you you have a co-payment of $20, or you may have a co-insurance of $20. And that just tells you how much you owe for that visit. And sometimes they can't tell you that up front because services may vary. And so that's when we start getting into what we'll talk about is the explanation of benefits. What your explanation of benefits really does is provide details about a claim that has been processed and what portion the insurance company paid and what portion may be your responsibility. And that what is your responsibility is your co-payment or co-insurance. So when you get that in the mail or online, that really just tells you what your insurance company paid for the services that your provider gave to you and what you may owe for that service. Sometimes you've paid that up front because they know what your co-payment is, or sometimes they may send you a bill after you get your explanation of benefits saying, hey, you owe us $20 because they paid the other 80%. So that is kind of what explanation of benefits, what you may or may not owe. And then we'll start talking about in-network. We talked about that a little bit with the different types of health insurance plans. In-network is really referring to the care or providers who are part of your insurance contracted network. So with that, you're looking at the people who are in network. You're going to pay the lowest amount of co-payments or co-insurance if you go with people who are inside of your insurance contracted network. If you go outside of that network or out of network, that is referring to providers who are not a part of your insurance contracted network. And a lot of times those type of services or providers are, if they're out of network, they're going to be more expensive because your insurance company has not contracted with them. So they have not negotiated the rates down to a lower level as they have done with an in-network provider. So that's something to take into consideration if you're looking for new providers, is checking that they're in network or out of network with your provider, because that may make the biggest difference when you're looking at cost and what ultimately will be out of pocket for you. Because if you go to in network providers, you're going to have a lower out of pocket than you would with out of network providers. And out of pocket that's the healthcare expenses that are not paid by your insurance company, and that's what you're responsible for. So that's your co-pays, your co-insurance, you know, meeting your deductible. That is all that comes out of pocket before you hit. All of those things are what comes out of your pocket, and you're not going to get what you have to pay for your healthcare. So with co-pays and co-insurance, once you match your deductible, that's a lot lower. But up front, let's say at the start of your benefits year, you may have to pay, if your deductible is $1,000, you may have to pay $1,000 out of pocket before your copays and your co-insurance starts hit. So you may have $1,000 that you have to hit before you start getting to those co-payments, co-insurances, where that decreases the amount of money that you have to pay for each time you go to the provider. So that's something to be aware of as you're comparing plans to see what's your out-of-pocket cost, because maybe if you're budgeting, you may want to do a higher premium so that you have a lower out-of-pocket, so that way your deductible is lower, so that way, each month if you're budgeting, you are paying less for your health care, out of pocket, because you're paying for it with your premium on the top. So those are all kind of things to think about and be familiar with as you're, starting to figure out what types of insurances that you want to look at, different plans, and a good way to compare options against all the different plans that are out there. And as this is part of Trans Healthcare 101, I definitely want to bring up trans exclusion policies. So there have been different laws that are out there that have given transgender people, equity in healthcare, but there are still policies that do have transgender exclusions inside of their policies. So you really need to, before you look into any plan and say that, hey, this is a plan that you want to go with, you need to make sure that if you're looking for any transgender related healthcare services, that they are going to be covered. There are still different policies that are out there that do exclude transgender health services, such as hormones or surgeries. And so you want to make sure that if you're getting a new policy, or if you're in the process of transitioning, that if you want to see if your policy does protect your that it has the ability for you to transition, by using your insurance, you want to look at that. So you may have to call your insurance company. A lot of times they do have that information online. If you go to your insurance provider and you say, hey, I want to see, does it exclude transgender healthcare services? You can go review that, because otherwise you're not making an accurate benefit comparisons. Also, transgender health insurance exclusions may be unlawful sex discrimination. And so that's something to always keep in the back of your mind. The law currently prohibits discrimination based upon sex, among other bases, in certain health programs and activities. This is really where knowing your rights comes into play, because the insurance company may say that, we have an exclusion, because of your certain employer plan. And so that may be something that you may have to go back to your HR team about and say, hey, why do we have this transgender health exclusion? Is there any way we can get this removed? Or just understanding, what is going on, why there is this exclusion, because sometimes they may not be know that it's in there and it may need to be removed, because they just renew the same policy every year. So this is where knowing, always feel free to ask questions of your insurance company to see if this is something that is their policy, or if it's something that your employer has added, if you have an employer-based health insurance plan, or if you're looking at market-based type plans to see, is there a trans exclusion, because maybe there's a better plan that is better suited for you, because sometimes health insurance companies may add an additional cost to the overall price of that plan, just to have those type of exclusion removed, because they may see that this population has a higher uses more services. So this is where, getting into the information and looking at it, but this is all information that you should be able to get from your health insurance company. So review any summary of benefits and coverage, ask them for that document, ask them if they have transgender exclusions, because you need to really know that information. And then if you want to plan for cost, determine the amount you'll pay monthly for premiums, multiply that by 12 to get, your kind of annual amount, so knowing how much your premium is, you multiply that by 12, that's your base rate, because you really want to know if you're planning for cost, if you're budgeting, because if you're transitioning medically, there can be a lot of costs that are involved. You may want to budget that out and understand where your costs are going to be. Establish the amount that you must pay to satisfy your annual deductible. So that's, again, money that's out of pocket that you're going to have to set aside separate from what you pay for your premiums each month, to make sure that your health insurance plan is paying for all the things that you want it to. And then, if you're on different medications, whether you're on hormones or other medications. You want to calculate your typical annual cost for those prescription medicines, especially if it's not a generic where it may be a lower cost. You want to definitely factor that in because you want to factor this all in to to your plan because you want to ultimately add up those first three and then compare them to your maximum out of pockets because there is only so much money after a certain point in the year or in your plan. If you reach that maximum out of pocket max, then you don't have to pay any more that year because you've hit your out of pocket max. So you hit your deductible plus your out of pocket max. So you want to make sure that you're somewhere in the midst of kind of both of those. This estimate really doesn't include though, co-pays or co-insurance because you don't know how many times you may have to go see the doctor, but kind of just like some baseline numbers for budgeting because once you've hit that deductible, your co-pays or co-insurance should make your provider's visits pretty low throughout the rest of the year. And another thing to also know is that preventative health services are also free without having to pay a copay or co-insurance. That is something that became enacted with the healthcare law a few years ago. So if you just need a physical, you need your basic lab work for the year, that is all built into your health insurance plan. So you don't have to pay any additional for that. It doesn't affect your deductible. It also doesn't affect your copay or co-insurance. So there are some ways that maybe if your provider bills it as a preventative service, that you can have that taken care of for free without having to hit your copay or co-insurance. So that's another thing to keep in mind if you're trying to manage costs and planning for, your general healthcare or for transition related costs that you may have. From there, how to find care. And so we're going to break this up if you are insured or if you are under or non-insured. So we're going to start with people that have, either a public or private insurance plan. So if you find a provider through word of mouth, everybody talks to each other about providers that are friendly and competent. Check with your health insurance company to see if they work with your insurance plan. If you don't really have any really recommendation leads, check with your health insurance company to see if they know of people that are in providers that are in your area. They may not necessarily be competent on transgender healthcare, but that may give you a start and may give you some leads if you feel comfortable enough to calling them to ask if they're comfortable with treating transgender patients or not. But that may give you a start. Sometimes they'll have filters that you can see LGBTQ plus friendly if you're looking for providers in a certain area, and that may be a great way to find healthcare. Also, telehealth options are a great way to find a provider in a bigger city that will provide you with competent care without having to travel each time, especially during this time of COVID that we've been in. A lot of telehealth options are being treated the same as, if you went in person for a visit. So they're being treated with equal weight. So this may be a good way to establish care with a new provider without having to necessarily travel if you live in one of the more rural areas to Nashville or Chattanooga or Knoxville or Memphis to get competent healthcare. So I would always keep that in the back of your mind of, telehealth has become this really great option for a lot of people. And you can also refer to our transgender resource provider listing as well. That's going to be on our website. That'll be at the end of the webinar saying, because we have gone through and vetted some of the providers that we know to be competent in transgender healthcare across the state. And so that's another place to go look for providers, and then you can see if they take your insurance or not from that point. Then, if you are underinsured or not insured, there's options for you to access healthcare as well. There may be state and or federal programs that provide you for free screenings. That's a great way to get some of your basics done throughout the year. If you are vulnerable to HIV, or different type of eh, healthcare, you can go through and get a free screening. There are sometimes counties may have medical assistant programs, which may be a sliding scale or to no cost to you based upon your income. Another really good option to go to using free clinics or income-based sliding scale clinics for preventative, routine, and primary care. That's also another really good way to be able to keep your costs down and keep them low and still get the healthcare you need. And so really just wanting people to make sure that they're checking in with their health and making sure that they're taking care of it. I think everybody sees the retail health clinics in different stores like Kroger and CVS. Those are a really good option because a lot of times they have a flat fee for whatever it is. So if you need, a physical, they'll have a flat fee of $100, or as for an example. That's a really great way to get get a physical done and get a baseline in, but not have an it's still $100 is a lot of money, but you don't have to pay for your premiums and all the other things. So if you look at the scale, if you have $1,000 deductible, or you can go get $100 physical, it may make more sense to go to one of those healthcare clinics inside of a store and just pay that flat fee. There's also prescription drug programs. A lot of times the manufacturers, giving them a call or looking on their website, they can help with an, if you can't afford your prescription, I think we hear it on every commercial nowadays, to contact the manufacturer, because they may have programs that can give you the drugs at a discounted cost. So that's another thing to look into. And also check with your closest universities and or teaching hospitals to find out if they have, a charity program, or if they provide free or reduced care services. They may be training future doctors or dentists or other types of providers, and going to one of these programs, you may have to go back multiple times, but if you can get it at a low to no cost, it may be worth it for you to keep your health fully intact. And so those are some options for if you are, underinsured or not insured at all. And from there, just want to wrap up. Please check out the rest of our webinar series on trans health. We're starting this because we see that there's a need to provide education to not only transgender people, but to also providers and other people that may be interested in providing healthcare to transgender individuals. We're also wanting to know if there are any topics that you would like for us to do a video on. Please put that on our website that I'll show on the next slide. But we also have 2 more webinars coming up in this kind of premiere season that we're doing during Trans Visibility Week. The next one will be healthcare options for those living with or vulnerable to HIV. That'll be on November 16th at 6 p.m. Central, 7 p.m. Eastern. And then Prep for Trans folks on November 18th at that same time, 6 p.m. Central, 7 p.m. Eastern. And so we're really trying to get this started and building a robust resource for transgender people across the state of Tennessee. So please connect with us. You can connect to us through this website, hivtn.net/TTF for Trans Task Force. I hope you enjoyed this presentation, and please reach out if you have questions, or there's things that you want us to do webinars on, or if you know of providers that are competent in the state of Tennessee that are not on our resource guide, please let us know that as well, because we want to get these providers vetted so that this is a good comprehensive resource for transgender people across the state of Tennessee. So please connect with us, and I hope you enjoyed watching this webinar.